Have you ever wondered the true price of our social safety net? I feel here in Washington we have so many programs. But where does all that money come from? Have we ever thought about it? Really? Where's all this money coming from? How are we funding all these different programs and things like that? So let's dive into that today. Today we dive into the billions Washington is spending on healthcare, housing, social services, and what that really means for you and for me, of course. And of course, our bottom line. From Medicaid expansion to free housing, we'll talk dollars, decisions, and debates around who pays and who benefits. I'm your host, Jay, and welcome back to the Evergreen Report Budget Breakdown Part 2. So, with that, Medicaid like services for undocumented immigrants now funded via state taxes. And this is one of those things that's hard to talk about because it's hard to say what the neutral side of this issue is. Like, where's the neutral side of this? Because we say, oh, we shouldn't take care of it, we shouldn't do it. You're against immigration. But if you say we do it, then you're just for immigration. And there's really no good argument here. That's the thing. But looking at this $5.8 million allocated for full state funded health coverage for adults who don't, it's just that we don't take care of our own people first. That's the thing. We see homeless people all over the state, drugged out of their minds on fentanyl, meth, opioids, you name it, they're doing it. See little groups of people shooting up, see people smoking, people getting high, people committing crimes that truly do need help, that truly do need health care, but they can't get it. They're American, they're Washingtonian, but because they don't check this extra box, being undocumented immigrant, they don't get full state funded health coverage. Think about that. That personally makes me a little disappointed, a little upset because I want to take care of everyone. I want to see all these good people in Washington, in South Seattle, in Seattle, all throughout the state, Spokane, here in the Tri Cities, everywhere. It's everywhere. It's every single city, every single corner you look on, dang near in the state. We see homelessness, we see drugs, we see people who really do need good health care. They just can't get it. But let's skip all these people front of the line. We're undocumented. It's it's hard to talk about. It's hard to see. It's hard to find a good position on. That makes sense. Then of course we roll into universal healthcare modeling. $250,000 is funded by the general fund taxes. Early step towards potential future health related payroll or income taxes. Rental assistance and housing operations funded by sales and property tax revenue. No new state No new taxes in stature, but these expansions will likely lead to future tax increases or increased draw on general funds, downstream local tax increases, cities compensating for growing state cost shifts. So those are kind of the new taxes when it comes to healthcare, housing, social services. There's not really much new except for these Medicaid-like services now being funded via state taxes, which come from the general fund, which comes from sales tax, property tax revenue, things like that. So let's look at the true cost of these things because there's a cost to all of it. Nothing's truly free. You say fully funded healthcare, state healthcare, free this, free this, free this, free that. None of it's free. So total health related spending, $35.6 billion in the new budget through various agencies like the HCA, the DSHS, spanning Medicaid programs through the HCA, $3.1 billion federally and $1.17 billion state for community behavioral health alone. $5.5 billion for behavioral health under the new authority. Medicaid-like programs for undocumented immigrants, $5.8 million for adults over 19 with income under 138% of the federal poverty limit who do not qualify for federal Medicaid. Requires same benefits as regular Medicaid, even for DACA recipients. The 988 crisis hotline, $18.7 million dedicated for crisis mental health response. Universal healthcare study, ideological, $250,000 allocated for modeling a single-payer healthcare system. Politically charged pushes towards government-run. So these are just some of the costs breakdown here in that $35.6 million, which is about half the budget, half the state budget. So you take the $29 billion that we covered yesterday on education, you mix it with this 39, yeah, 35.6. So 29 plus 35.6, you're looking at 64.6. So you're looking at, I don't even know, 64.6 divided by 78 billion. 82, 83% of the budget right there between just education and healthcare and social services. A lot of money for those two things. A lot. And these impacts on you and I, the taxpayers, rising premiums, especially for small business owners, shift in care costs from federal to state taxes fill the gaps here, greater burden on property owners via indirect cost pass-throughs, county health services, crisis beds, etc. And I want to remind everybody here, property taxes don't just affect your property that you live on. They also affect the small businesses. They also affect grocery stores. They also affect schools. Property taxes are not just for those who own homes, but it's for everyone who owns any kind of property in the state. That's where it all comes from. So schools have to pay these property taxes. Small businesses, nonprofits, doctors, everyone has to pay these property taxes. And that cost essentially always comes back to you. Let's want you to remember that here. Just remember that. Housing spending explosion. So major allocations, $74 million for permanent supportive housing operations and maintenance, 22.5 million for rental subsidies for higher barrier homeless individuals, mental health, addiction, criminal record, $5 million for youth homelessness prevention and car repairs, birth certificates, or short-term rent, 3.6 billion in housing trust fund capital from the capital budget, helping build low, no-income housing. So you look at all this money here just for housing, $74 million, 22.5 million. So now you're looking at about $100 million there, $105 million plus $3.6 billion in housing trust fund capital from the capital budget. So helping build low income, no income housing to help people get off the street. But again, that's good, but where's the help for those already here in the state that are already having trouble affording what they're already in because of the cost of living going up? And you have to remember as well, I mentioned that property taxes affect everyone. You look at apartment complexes, these low income properties where people live, that affects them too. That affects every single person in the state because property taxes will be trickled down to everybody to pay more in some way, shape, or form. But kind of looking at the housing part from the local angle, in Seattle, newly funded housing units already face criticism from residents who say homeless encampments just shift blocks. In Spokane, concern over permanent housing with no drug testing or work requirement is growing. Taxpayer impact, higher sales and property taxes due to subsidies and bond repayments, lower neighborhood property values near no barrier housing, strain on local services like fire, police near facilities with untreated substance use disorder or mental illness. And again, I remember working at Circle K many years ago, and we were right down the street. It was this was still during where they were giving out the vouchers and things like this, right? And there was a hotel that had one of those voucher programs going on. These homeless people, they had these vouchers for food, house, for hotel rooms, for everything, right? And it was just wasted. They would just go and spend it on junk food, soda, candy, chips, things like that. They weren't actually buying anything because there was no requirement. There was no accountability for them. They just go and spend it, right? But then you constantly saw police or medical services coming and helping these people because they were able to still cash it out at the same time to get cash to buy drugs. And it was really disappointing because it goes untreated. These mental illnesses, yes, you can put them in housing, but you're not requiring them to be clean. You're not requiring them to be getting treatment. You're not requiring them to get work. You're not requiring them to be in any kind of mental health services. You're not requiring them anything. You're saying, "Oh, here you go. Here's a nicely furnished place. Go and ruin it. Go and destroy it." Not everyone will, of course, but here's a reason for you to get off the street so we can say we're getting people off the street. But we're not actually, gonna help you actually treat your addiction or your mental illness or both at the same time, or help you get work, help you drug test or anything like that. You're just gonna give it to you with no, really requirements to do so. And that affects everyone around the property, the neighborhood. Now is more unsafe, essentially, because now you have drugs and crime and homelessness and mental illness. Those things don't mix really well. Property values go down. No one wants to live there. It's harder to move because you can't sell your home for as much as you bought it for. So then you're kind of stuck, and it's a whole cycle. We don't often enough, I feel, think about the total impact of all these things. We don't think, oh my goodness, what rabbit hole am I going down? Where is this going to lead? How is this going to continue? We don't think about all these things that it could lead to. We just think, oh, yep, good. Housing, For homeless people, drug addiction, good. We don't think about anything beyond that. I didn't really talk anything about this money going to behavioral health services. This is actually the industry I work in. I think it's good. I think our youth need more mental health and behavioral health services in the state. We see a lot of issues. We see it rising. More and more kids need this kind of help, these type of services. Making it more accessible is great. I just wish that it could be more accessible to those that are not on state insurance, that are not working with the state through the HCA, that can also benefit from these services as well. Because there's a lot of kids who may have private insurance that could also really benefit from these as well. But I do think this is a growing area of need in our state, really beneficial to a lot of children. Let's see, behavioral health growing but disconnected. So this again, going into behavioral health here. I didn't even mean to do that. That was a happy transition here. 1.66 billion to the DSHS mental health programs, 500,000 to co-responder programs, funding for mental health teams without police, 250,000 to expand opioid treatment in Kitsap and King counties. Oh God, do they need it? They really do. 85,000 to a behavioral health legislative committee. What that's going to do, we don't know. Of course, we don't know what those funds are planned for. Um, let's see. I really don't know what any of these actually truly go and do. So what we're going to do is we're going to take a moment. We're going to go and look it up to see what the heck these funds actually do. Because I'm curious, probably just as much as you're curious. Because these are just numbers to me, right? You just hear these numbers and you're like, okay, those are great, but where does that money go? Well, let's figure it out. So the 1.66 billion into the DSHS mental health programs. This is looking like it's money from the general fund, some from the federal level, some from private local. What it covers is operations of state psychiatric hospitals and resident treatment centers, community mental health services, including wraparound with intensive services, so Y services around the state, crisis stabilization and triage, secure withdrawal management, assertive community treatment teams, and peer support programs, housing and recovering services. 300,000 of this specifically for a community policing partnership with Lakewood around Western State Hospital. For these co-responder mental health teams, grants to cities for co-responder models, non-police crisis response, fund support for community-based alternatives like LEAD, law enforcement assisted diversion, mobile crisis teams, and facility-based stabilization. The goal of this money is to divert individuals away from jail and ER into treatment. Note this is part of the 5.7 million broader alternative response funding package, 4 million into Association of Washington Cities for crisis response teams, 1.17 million for regional teams and Whatcom County Response Unit. $250 for the opioid treatment in Kitsap and King County. This is one-time funding. Okay, so this is where we really need to be careful when it comes to these one-time funding to expand service hours. This is to the Kitsap County Recovery Resource Center in North Kitsap. So this is to a center, one-time funding here. That we have to emphasize that one-time funding. We saw there was COVID. It really messed up a lot of businesses. It really messed up a lot of things because it was one-time funding. Expand service hours, support peer groups and vocational programs, provide recovery cafe services. Seattle provider impacted by flooding, 250,000 and for 2024, 750,000 for 2025. Temporary service operations post flood at a major opioid use disorder clinic in Seattle. So that's where that's going. The $850,000 for behavioral health legislative committee. This is the annual funding for a joint committee. A purpose to elevate behavioral health policies, guide legislative efforts, likely support subcommittees, policy research, and legislative recommendation. So where these tax dollars are going, kind of a brief summary, is the mental health programs of 1.73 billion, hospitals, crisis response, WISE, peer support, housing, co-responder programs, 500,000 of the 5.7 million, so that's even more there, so 5.17 million. Kitsap opioid treatment, $1 million to support recovery, flood recovery, service expansion, and behavioral health committee, $170,000 on the biennium, behavioral health policy planning and oversight. So that's kind of exactly where this money's going for. So I think that's important to know exactly where it's going. That's what I want to know. I want to know exactly where this money's going. I think the housing one's pretty straightforward for where that money's going to go. But for these, where it just says like another agency, we want to know exactly kind of what that's going to affect, how it's going to be affected, how it's going to be impacted, and where it's going to go to have an answer. So there's growing belief. So some controversies here. With any line item, there's going to be controversies. There's two sides to every coin, right? The growing belief that massive mental health spending is not improving outcomes. I mean, you may be right. You could very well be right. Critics say real reform is blocked by DEI mandates and staff burnout. I would say it's more so the staff burnout. Working in this field myself, it's a high burnout, high turnover field. I've worked at one agency for 2 years now, and the amount of turnover is insane because burnt out, high demand, high need people. A lot of people need the help, and there's just not enough of it to go around. Left-leaning policies like removing law enforcement and crisis calls are untested at scale. Yes, I agree with that. You still want law enforcement and crisis calls because sometimes you do need law enforcement and crisis calls. A social worker isn't always going to be there to be the best support for these kind of situations. All right. Next area that we're looking into here is the work first and welfare program. So we're going to jump into this kind of just a brief, 30,000 foot overview here. 3.4 billion total for economic services programs like TANF, childcare, job training. We're going to break down these numbers here in just a moment. 530.5 million just for assistance to clients, grants, diversion cash, emergency support. $100,000 for a poverty equity study in Seattle. Let's dive into what this money's actually going to here in just a moment. I'm gonna wet my whistle, as I used to say back in the day. All right. So total program budget 3.394 billion. Funding sources 1.47 billion for the state general from the general fund, 1.91 billion from federal funds, 5 million from local funds, 4 million from admin contingency fund, 2.4 million from the domestic violence prevention account. Breakdown of spending. Work first program, TANF related, 1.26 billion, 385 million from state funds over 2 years, federal fund, blah, 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 blah. This includes cash assistance, childcare subsidies, job training and readiness programs, program administration. Impacted family. This covers basic survival needs, cash, food, housing for low-income families and single parents. Some funds are flexible, allowing short-term help like rent, car repairs, ID replacement. Direct assistance to clients. 530.5 million of the above workforce funds is explicitly earmarked for cash grants, diversion cash for those at risk of needing full benefit, emergency aid for families that just missed eligibility threshold. Then this poverty equity study. $100,000 doesn't sound like something we need. We could probably use $100,000. I don't know, put it into education maybe. I don't know. Contract with nonprofit that focuses on racial equity and poverty reduction. Funds a steering committee made up of people with lived experience in poverty. Covers stipends, childcare, travel, and staff facilitation. Homelessness prevention, youth services, housing, other support programs funded under this umbrella. 5.6 million total for homeless youth, foreclosure prevention, and emergency housing support. Programs targeting young adults under 25, low-income families, recently arrived immigrant families, going to like somewhere like the Tukwila Refugee Housing Fund. Let's see. The impact on you and I on this one's pretty straightforward. Washingtonians pay both state and federal taxes that feed this program. New or expanded benefits may increase demand for working family tax credit and earned income tax credit, and also requiring outreach funding from this budget. Administrative costs are wrapped into the general appropriations. Controversial or ideological points here is obviously this $100,000 because it's race focused and involves advisory steering by lived experience members, has no concrete deliverables tied to measurable outcomes. Like it sounds like a feel good line item, while real services needs go unmet. Like put this $100,000 into TANF, put it into SNAP, put it into the homeless, put it into building these shelters, these facilities, things like that. Put it into the mental health treatment, put it into the mental health or the substance use abuse treatment programs as well. We don't need this study. No one needs $100,000 Seattle poverty study. I don't know why we need it. It's a feel good study. I mean, does it help anyone eat dinner? When the study's done, is it going to help people eat dinner that night? Is it going to get them off the street? No. No, it's not. It's not going to help them. Why do we need it? Let's go back here. Run it back. Back focus. Of course, you look at the political framing of this segment that we're kind of on here. The workforce and the welfare programs is we have a massive nanny state here in the United States, and it's going to take a long time to dismantle that. It's going to take a massive effort. It's going to take a massive reform. It's going to take a lot of people doing, we need a lot of jobs available to feed people into. And it just would take so much reform because we have a culture of dependence. And that's just what we have in the States, period. Not just in Washington, we have it everywhere in the state. It's also frustrating that some of these grants are not tied to work or drug testing requirement. Like there's no requirement to get some of these programs. Like you don't have to be working, you don't have to be doing anything. If you are going to get this money, you have to be earning it It can't just be freely given. That's the mistake we make. So we spend, 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 spend. And yes, I want to take care of people. I want to see people do better. I want to see people heal and recover and have a successful outcome for the rest of their life. I don't want to see people be dependent on government forever. I want to see these people get clean. I want to see them get mentally healthy, physically healthy, emotionally healthy, spiritually healthy as well. Like I want to see them get healthy. I don't want to just see them get put into a place with a roof over the head, clothes on their back, maybe a little bit of food here and there, and a voucher coming in once every couple of weeks to kind of go buy some food or whatever. Um, if we're going to fund these programs, they need to be getting substance use treatment. They need to be getting mental health treatment. They need to be getting treatment, period. They need to be getting work. They need to be getting work requirements. They need to have drug testing. They need to stay clean if they want to be in these situations. They can't just be given. They have to earn them. It can't just be given to them. It has to be earned. And of course, working families that are paying higher taxes but receiving none of these benefits, look at this and you're like, well, if we're funding all this, but they're not really required to get it, why do we keep funding it? What's the point? And that's a great question because there really isn't a point. If we're just going to be funding all this, what's the point? There is none. Let's see. Let's talk about some controversy. Ideology versus necessity. That's the question here. Ideology is ideas that are just ideological. They sound great. They feel good. It's the feeling. They're feeling items, right? Feel good to have poverty equity study, or whatever other study that there is, right? But what's the point of it? What's it actually help? The 250 that I mentioned earlier, that's allocated for consultant services, dedicated actuarial support, and economic modeling under the Universal Healthcare Commission. Funding goes to staff salaries and legislative coordination efforts. Why we don't need that. If we're just going to fund salaries and coordination efforts, ditch it. We don't need it. Get rid of it. $250,000. We can use it somewhere else. That's just money being pulled from the general fund, and we could put it somewhere else. You could put it anywhere else in the state budget, line over line, and put that somewhere else where it could actually be of benefit to the people right now, not just to staff salaries, coordination efforts. What's that going to do? It's more money that's being spent to pursue single-payer healthcare, which many view as inefficient or financially unsustainable. Supporters claim it is needed to analyze long-term cost reductions and equity. I mean, not everything has to be about equity. That's just thrown in for everything. It's like, oh, it's not equitable. It's not equal. Not all things are equal. I mean, just let it be what it's going to be. Why pursue it? There's no benefit to the average taxpayer in the near term. This could lead to major systemic reforms depending on future legislative decisions, but they'll continue it for whatever way ideologically best serves them anyway. So what's the point? Get rid of it. We don't need this line item. Medicaid drop-off auto-enrollment study. What this is funded through the Health Benefit Exchange Account. We'll explore automatically re-enrolling individuals who lose Medicaid into zero premium qualified health plans, prevent health coverage loss during redetermination, okay, evaluate demographic economic data, policy feasibility, okay. Some see this as an unnecessary state overreach into personal insurance choices. Others argue it's a humane solution to avoid coverage gaps. Yeah, I mean, it helps a lot of it can help 100,000 people transition between plans post-pandemic Medicaid expansion. So I think this helps. This isn't a bad thing. I think there's a way to do it that's more efficient. To maybe you don't need $300,000 to do it, but that essentially comes down to if it helps 100,000 people, 3 times 100,000, that's $3 a person. That seems like a pretty good deal. If it could become more efficient, you can automate that a bit more. It could be even more helpful. No barrier housing entry programs, state-funded projects that do not require sobriety, employment, or treatment enrollment as conditions for entry into housing. $177,000 for 70 harm reduction shelter beds in Kitsap County. $625,000 for youth family social support programming in Snohomish County. Additional housing-related funds to Seattle-based nonprofits for BIPOC family relocation lists and Ukrainian refugee housing. But there's no requirement here. There's no requirement for sobriety, employment, treatment enrollment, or any kind of workforce preparation. Like, be doing something. We can't just fund your lifestyle for as long as you want to be in this transitional period. Yes, I know it wasn't by choice, but you need to be doing something to get better. You need to be earning this money that you're being given to essentially help you get back on your feet. You need to be actively working, right? We need to be working. These things can't just be given to us. We can't just expect, this things to come to us and have that sense of entitlement like we do. We need to be putting the work in to recover and get better. Recovery takes action, takes choice, takes work. This could enable drug use and disorder without accountability. Yeah, obviously. Proponents say housing first is evidence-based and reduces long-term costs. Yeah, I mean, housing first is great, but you also have Maslow's hierarchy of needs: food, water, shelter, clothing, warmth. But then again, you also need to be clean. You also need to be getting the right treatment, sobriety, employment, things like that to actually have long-term success. Suburban neighborhoods regarding new shelter locations, definitely is some pushback, and it could reshape how homelessness is handled regionally. Medicaid-like services for non-citizen DACA recipients. Like I talked about at the very beginning of this podcast, it's really hard to stay in any kind of neutral ground on this one. As much as you want to can be difficult. It is what it is. Expands Medicaid-like coverage to undocumented immigrants, DACA recipients, non-citizens ineligible for federal programs. Allocation here is 5.8 million. But then this jumps, right? This is a massive, massive jump. 5.8 million currently. And then it's going to jump to $64.6 million for fiscal year 25. 71.3 million in 2026, and 71 back down to 71 million in 2027. We jump from 5.8 million to where it's at currently, the current allocation, to $64.6 million when this is reallocated, when this budget's signed. The biennium, 212 million for Medicaid-like services for non-citizens and DACA recipients, undocumented immigrants, non-citizens ineligible for federal programs. We're going to, what is six times nine? We're going to 9x this budget, nearly, or no, 10x this budget. If we're rounding up to 10 times this budget immediately. Full scope medical, behavioral, preventative care, enrollment and redetermination modeled after Medicaid. We're using taxpayer dollars for individuals without legal residency status. Yes, of course, there's public health, humanitarian concerns, but essentially $30 per resident to fund this initiative across the biennium, based on the state population of 7.5 million. But yes, it sounds like, okay, $30 to help that, but wouldn't you rather have your $30 going to actual, state residents, veterans, homeless, seniors who are still able to, find work, get work, but instead we're going to 10x this budget. And I think that's what's really something that you really need to take a deep look at here and think about that. They're going from $5.8 million to $64.6 million, essentially overnight when this budget is signed and passes. Just think about that. Just think about it. That's all I want you to do, just think about it. And then, of course, you have the local resistance to crisis beds and needles exchanges. The budget includes support for harm reduction models in urban areas. Suburban towns are resisting citing new crisis stabilization beds, needle exchanges, or shelters. Some counties like Snohomish, Kitsap have pushed back against Seattle-style interventions. Seattle-style interventions do not work. I think we've learned that. The jumpstart payroll tax didn't work. Other things that have happened in Seattle, they don't work. But yet they want to push all these Seattle-style interventions to the whole state because they think that's what's best. When they're proven time and time again, they don't work. And we wonder why counties push back and be like, I don't know about all that. But at the same time, Democrats in the House, they don't care what happens in Olympia. They don't care. They just want to push. Anything that happened in Seattle, we're going to push it out to the whole state because obviously it works in Seattle, when obviously in reality it doesn't, but we don't care. We're just going to push because we can. This highlights a growing rural-urban divide in Washington's approach to mental health and addiction. I mean, there's a divide between the rural areas and the urban areas. And then, of course, $130 million in behavioral health funding statewide, but limited uptake in certain jurisdictions. I mean, yes, there's money to go around, but in the densely populated areas, that's where they're going to get the money. But in more rural areas, it's going to be harder to get those services, even though they're going to be needed, if not more needed, than in these urban areas. So there's more to think about there. Again, this is just more for everyone to think about. And just think about how much this truly costs you. Medicaid, mental health, housing spending alone, top $40 billion. Between this and education, we're looking at 83% of the budget. And I still got 3 more episodes to talk about of other things. We haven't even talked about transportation, gas tax, B&O tax. We haven't even talked about those things yet. Sales tax hikes, property tax growth, increased fees coming to fund these programs. That's what's coming. Hidden costs like reduced public safety near housing sites or longer ER wait times, they aren't in the budget, but real to us. These things are real to us. That's what's going to happen, is that we see all these things, pass these budgets, but when there's 40 immigrants in the ER, because they have fully funded healthcare and they're getting all their stuff done, taken care of because it's all funded. But you're having to pay thousands upon thousands of dollars in medical expenses. But you're a hardworking, tax-paying Washingtonians that's funding that healthcare for someone else that could be here illegally. You're funding that for them, but yet you're having to pay hundreds upon thousands of dollars to get it for yourself, and no one's helping you out. You are a hardworking Washingtonian, and no one's helping you out. They're leaving you behind and saying, "Give us more of your money so we can push these ideas and push all this healthcare out to other people, but we're going to leave you, your kids, behind because you don't qualify for the state Medicaid anyway. So we're going to give it to someone else who's here illegally because we're a sanctuary state, and you're just going to be no the better for it. Your kids are going to suffer. These kids are going to be taken care of before yours. We're going to put them in the front of the line, put yours in the back." That's what's happening. That's what's happening. Whether you like it or not, you want to call it what it is, that's what it is. Call a spade a spade. Gosh, I've been wanting to say that. But call a spade here, right? You put that into reality is your kid may have autism, your kid may have big behavior problems. They need this behavioral support. They need wise wraparound services with intensive support. And you can't get it because you don't qualify for Medicaid, but that person who's here illegally gets all the help and support they need for a kid that may not even need it. While you're no the better for it, you're suffering, your family's suffering, your kid's suffering, and they're unsuccessful later in life because of it. Because the state doesn't care about you, it cares about those who shouldn't be here in the first place. And that's just fact of the matter. That's just a fact of the matter. We need to take care of our own first, make it so that those who need it, these kids who desperately need these services, they can't control what insurance they're on. They can't control how much their mom and dad make, but make it accessible. We talk about accessibility, equity, inclusion, make it more inclusive to these kids who need it. I know 3 kids at church who need it. They can't get it because their parents make too much. They work at the nuclear site. They're on private insurance. They can't get these services. These parents are so upset. Like, oh man, I would love that. The kid really needs it, but I don't qualify. They see it. The average person sees it. It's not secret. It's not a secret. And it's just frustrating. It's disappointing that we're being let down by our own government, by our own state, because, immigrant first instead of American first. Instead of Washingtonian first, immigrant first. And I just want you to remember that as we continue to go through this budget, we're through 2 episodes now, and that's a common theme. Putting those who aren't here to begin with, who aren't hardworking, tax-paying Washingtonians, putting those who aren't in front of those who are. You're in the back of the line, they're in front of you. You're none the better for it. And I just want to ask, is this budget compassion or compulsion? Are we solving root issues or just throwing money at symptoms? Let me know what you think, please. Is this budget compassion, compulsion? Are we solving root issues or are we just throwing money at the symptoms? I don't know. I want to know what you think. I know what I think. I think we're just throwing money at the symptoms, hoping it works, and being able to say, "Oh yeah, we funded that. We built 3 shelters and got 100, 200 people off the streets for free." But then what happened to them? Well, we got them off the streets. But then what happened? Did they get clean? Do they have a better life? Are they working? Are they contributing? Are they paying back those taxes that they took with no issue? Are they paying them back? Well, we got them all. We got 200 people off the street. Okay, but what did those 200 people then do to contribute to the state, to make reparations, if you will, for the state that they took from? What are they doing to pay it back? Oh, well, there are 200 people off the street, so they're doing nothing. No, they're not doing nothing. They're off the street. Think, people. So I want you to remember here. Make sure you hit that follow button. Make sure to subscribe. Share this episode with someone who's tired of being told their concerns don't matter. Share it with someone else who's also tired of being put in the back of the line while other people who aren't supposed to be here in the first place get put in front. And until next time, this has been the Evergreen Report. I'll see you next time on part 3 of the Budget Breakdown.